Hey, everybody, thanks for jumping on. I'm Ben Ceccarelli. I'm the Chief Brand Officer here at StemWave. And so every couple weeks, we do these live Q&A videos with one of our amazing providers, basically to give you a behind the scenes look at how they're using StemWave in their practice and clinic, what kind of results they're seeing with their patients, also like what their journey looked like when they first got started. And I know there's a bunch of people that are going to be watching this because they're curious, maybe they're on the fence, and that's what this is for. So it's no sales pitch, just real talk, real providers, and hopefully it answers a lot of your questions about StemWave. Hopefully it gives you a clearer picture of what's possible with this device. And without further ado, we'll get into it. And today I'm very excited to be joined by Natalie Stratton from Advanced Physical Therapy with 13 clinics across Illinois, Iowa, and Missouri. Welcome, Natalie.
Thank you very much. Excited to be here.
So, wow, 13 clinics across
Yeah.
3 states. I think that's what makes today's live Q&A special for me is
Mhm.
you're a provider that's a little bit different than what we usually have on here. Usually it's like a provider that's either just starting out at their new clinic or they're branching off and doing something kind of small. I mean, you've got this conglomerate going right now. Can you give everybody an idea of like, obviously you didn't start with 13 clinics. Give
Right.
us a little bit idea of your background and what got you here today.
Yeah, awesome. Pretty much we back in like 19 as far as 1995 is when we originally started, but in 2000 is when we started opening up just here in Quincy and um back as like an outpatient physical therapy clinic. There was like three of us practicing at the time. And then from there, we've kind of grown over the years and expanded into the other areas. But originally, it was just as far as like three therapists. There was four partners that started it, and one of those is a business, the manager, and then another the therapist, and then the fourth therapist as well. And then we've just built, added on over the years, kind of looking in more the underprivileged area as far as trying to provide services, and then just expanding, kind of just seeing where we know we kind of stay away from larger city areas. And that's just how, we've kind of expanded over the last since, but let's say I said 2001 is when we bought it back that second time. So and started always outpatient physical therapy. We did a lot of manual therapy, some of like, your traditional as far as exercises, but we've always had kind of, that's what we built, is just we wanted to be different. We just didn't want to be, a cookie butt cutter box kind of place. And so we've always kind of prided ourselves on doing a lot of like manual therapy, looking for always bringing in continuing education, looking for just treatments out there that were helping people and that we could kind of be on the cutting edge, and providing something different from everybody else. So that's kind of in a nutshell. I can go into more specifics if you want, but that's kind of over, like I said, over those last 25 years is how we've grown. So.
And I mean, were you somebody that like in school was like, oh, I definitely want to go into this? Or did you kind of shift gears later? We have a lot of providers
Okay.
that actually got into like their field because they themselves received treatment one time and they're like, oh, I think I want to do this. Was it something similar to that? Or how did you get?
Yeah, well, so everybody asked me that because I did have an ACL injury, and that was like, yes, I went, but actually it was before that because I had a cousin that was in a really bad like ATV accident, and I just watched him rehab, and I was fascinated by that whole, like his whole like journey and recovery. And so starting in high school, like I was like, this is what I want to do. Well, then I had an ACL injury, and I was like, okay, um, this is good. Okay, this is kind of what I want to do. So I was a little bit like driven. I mean, I'd say the only thing that I was debating whether I wanted to go to medical school or PT school. But I still just always liked more of the, I guess, the hands-on manual type. That was more where I wanted to be. And so ultimately, obviously, chose PT, and then that's where I went. So.
Yeah, I mean, I think it
Yeah.
also speaks like you seem like the type of person like you want to help people. Like that
Yeah.
at the
Yeah.
base of everything, the core value is you just want to help people.
Yes. That's again, that's what drives me every day.
Yeah.
And again, that's kind of why I always would look for things because, somebody comes in, I don't know. And it's like, okay, I want to try to figure that out and find out, how can I help you? So.
Yeah. So what were like the most kind of typical cases that you were seeing coming in when you were doing more so manual therapies at your clinics?
So a lot of, I mean, obviously a lot of low back neck pain, but just because of the way PT is set up and we have to have a referral system, like we don't necessarily get a lot of acute, like, hey, I hurt my back, 2 days ago, and then I come in. So I would say we ended up tending to get almost more chronic. And so chronic pain that just wasn't getting better. So yes, did we have some of that acute? And I loved that. That's so much easier to treat. But we also were, again, we were trying to compete with others in town. So we had to be able to get, these chronic conditions better. So we saw a lot of that, like chronic spine, I'd say both neck and back. And then we had a big sports and medicine piece of it too. And so we would see, definitely post-surgical athletes. And then as we've kind of developed the orthopedics, then we're also getting some of the, traditional, total joints and that type of stuff as well. So we have kind of that total joint, or like I would say your kind of typical orthopedic outpatient. But then we had that chronic pain, and then I have women's health. And we kind of have all the specialties now, but that in the beginning, it was definitely chronic low back pain. So.
And what were you mentioned like obviously there was competition. What were some of the things that you were doing early on to stand out from some of the competitors?
Again, I would say, in general, it was the different manual therapy techniques. I used a lot of, we tend to be a little bit more osteopathic based. So some of the muscle energy techniques, and then like like myofascial, Graston, those types of soft tissue type of techniques as well. A lot with neural tension, different. Honestly, I always say I'm a jack of all trades and don't have a specialty in any of it because I never wanted to necessarily align myself with one philosophy. So I would just always kind of pick and, all the different philosophies. So,
Swiss Army knife of treating.
yes,
That's the
yes.
goal. So, were any of these things that you were trying to do to make sure you had like the right remedy, other
Hmm.
modalities? I know that you said you were heavy on manual, but like, did you
Yeah.
ever try any other modalities
Um, well, I mean, obviously we had
or
like
devices?
yeah, ultrasound.
Mm.
The one, I mean, as far as ultrasound, electrical stem, um, we have and, traction. I mean, those were like kind of like standard. The only other one that I tried to, or this is more of recent, but would have been the cold laser. But it from a, I mean, I brought it in. I would love it, but from a practicality, again, it wasn't reimbursed, and so the studies on that weren't just as robust, and we just couldn't justify it at the time. So
Yeah.
that would have been the only like other modality out there that I would say that we looked at, but then didn't end up bringing in.
Yeah. I think there's a lot of medical providers out there that have tested, played with the cold laser. I think for a
Yeah,
while it was like the hot
yeah,
gadget for a
yes,
long
yes,
time.
yes,
Um, and so it's not surprising that you guys looked into it as well. But
yeah,
it's clear to me just from what you're saying that you're the type of medical provider that you want to find solutions for your patients. It's frustrating to you when you can't.
yes,
And
yeah,
so I guess that is a nice segue to, well, then
yeah.
how did StemWave pop on your radar?
Well, so is it that exact kind of condition? I was treating an athlete with plantar fasciitis, and she was on my daughter's team, so there was a little personal incentive there too to get her better. And she wasn't, and she was super frustrated. And her mom had actually said, "Hey, have you ever heard of shockwave therapy?" And I was like, no, I was like PRP. I mean, I was a big fan of PRP, and we can talk about that later. But so I was just like, okay. I mean, PRP, is it something along that? She's like, no, shockwave. So then that's when I started, I was just started, searching. At the same time, I was also looking just as far as other, because of the PRP, but other things that actually stimulate that mesenchymal stem cell. So that's what got me there. And I again, one of you guys's ads or something popped up, so that was well worth it.
They work.
It did work. I was like, oh, okay, this let me look into this. And then I kind of investigated your company and just to see, and then kind of went with the phone call. I knew like I wanted shockwave. I was just trying to, like, I really wanted to make sure I got the right one and the right like brand and all that. And then just trying to see that feasibility of it. That took a little convincing, but again, it's like I felt like I saw enough evidence that was like, okay, this is definitely helping people, and I knew it was something that was helping at the cellular level because that's what I was starting to look at. And again, just because I know, I mean, I have, like I said, I have different modalities, I have my hands, I have different things that I can get people better, but sometimes you just can't get to that cellular level. And that's exactly what I tell people is just that, this is the best non-invasive way I can get there, or we can at least try to change that.
Yeah,
So,
and you just said something that I think is key that I want to touch on in a second, which was about you wanted to make sure you got the right device in the
yeah,
shockwave field.
yeah,
But before that, I am curious,
yeah.
your daughter's friend's mom,
Yes.
how did she know about shockwave?
So there, I guess one of the medical facilities here in town brought it to their clinic for like I don't know if it was a month or if it was like kind of a traveling thing. And so one of her friends had tried like one treatment and was like so much better. So that's what she's like, have you, so
That's
that
cool.
that was why they didn't keep it, but
Right.
that was what she was. And again, there was a little desperation there because we need the daughter to play basketball. So I mean, it's
That's
just
cool though. I mean, I think it's for everybody at this company and anybody who's interested in shockwave, it's kind of cool to know that those types of conversations are now happening at
yeah,
kids sporting events. I
yeah,
mean, people are talking
yeah,
about shockwave now. I mean, back
yeah,
in the day, it would have been, I don't know, whatever pain pills out there or cortisone injections or something. So
yeah,
we're happy to know that there's like regenerative therapy being discussed at kids
yeah.
sporting events, and that's great.
Well, and that's the thing is she had already had like a cortisone injection and it wasn't getting any better too, so it's like that's even like it's like they just know like that's not helping. So
Yeah, cool. So your interest was piqued
uh-huh.
with Shockwave. You saw some of our ads,
Yeah.
and then like you said, you wanted to make sure you got the right device, the right brand, the right type of shockwave. So what was it that drew you to StemWave more so than our other competitors or other devices out there?
Uh, One, just the ease to like talk to you. I mean, or talk to somebody. And I guess just even the like being able to trial it, that was big. Because that's where, again, in the PT world, I know like some practitioners, I mean, we're still in an insurance model base. And so for people to private pay for something isn't exactly like, yeah, that's just kind of what we're going to do. So I knew we had to have that like it from a cost perspective and like okay I need to see is this going to work and so just having to be able to have that trial period that was huge.
Yeah, and
uh,
I think for anybody that doesn't know,
yeah,
you can try out StemWave for 60 days. And if you don't like it or whatever, you can send it back. You don't have to pay for anything. So that's just how much we believe in the product and we know that it's effective, is that we are confident to let you use it for 60 days.
yes, so that was big. And I think and again it was able to for me to get a feel for just with my own patients that I had at the time, like okay, how many of these are going to be willing to like go for this, and that it worked. So it was good. I mean, it was just like, all right, my gut of what I thought was going to happen was pretty much what happened. I mean, it's like I've been treating some of these people for a long time, or I've just developed a relationship with me, so they know that I'm not just going to like tell them to do something that's way out there. Now, some of the things I do might sound like they're way out there, but they've trusted me to see that I've had good outcomes. And so it was definitely, and then just they responded well too. So it was like, all right, I know I know we can make this work. So
Yeah, and you mentioned before that you were really interested with the idea that it gets down to the cellular level.
yes.
Did you, when you first started like thinking about getting StemWave or just even thinking about shockwave in general, did you do research into like what types of studies have been done on shockwave? Like, were you looking into that science side as
Yeah.
well?
Yes. Yeah. I looked at all the I mean, as far as just like, like on PubMed, I mean, there's 1,000 of them. And just even trying to understand, like, more so just so I can understand the differences of it. And I don't know how technical you want me to get, but just like the electrohydraulic, the radial, the pulse waves, that I mean, the pressure wave, and then versus even the piezoelectric, because a lot of the piezoelectric was more in some of the PTE offices, and so some PTs have been familiar with that. So just again, really trying to even look at the research to see what if the differences were and what was showed the most favorable outcomes.
Yeah, and
So
I'm
I
glad
knew I wanted that electrohydraulic. So
yeah. And I'm glad you
yeah,
did that research. You know, there's the one thing that is a little annoying in the shockwave world is how loosely people are throwing that term around.
yeah, no, and actually I'm more annoyed with it now because that's what people like. I talked to a guy the other day and he's like, well, can't I just get this off the internet? And I'm like, well, you probably can get like a radial. What I said, that's where you need to understand. And I don't mind taking that time to explain it to him. And he's like, oh, okay, thank you. Like just to know the differences and that there's a reason that this product works and that maybe it's more expensive than what you think that you can just go get, off the internet. So
Yeah. And we partner with major sports teams and D1
mhm.
college teams. And I was actually on the phone with somebody from an NFL team the other week. And I said, "Oh, have you heard of Shockwave?" He said, "Oh yeah, I think I got that on my shoulder." I said, "Oh, where did you get it?" And when he told me he got it at like his local, just primary care physician, I said, "I
Yeah.
don't think you got it." Turned out I was right. Turned out he just got like a radial device. And when I
Okay.
sent him to an actual StemWave provider, he
But yeah.
called me back and he's like, "Okay, that is so different. This is like
Yeah.
so much better."
Yeah. Yes. Yes. Very much so. That's what, yeah, I would love for all sports teams to be able to have it, by the way, because
We're
that's
working on that. That's part of our mission. Yeah.
dealing with my son and his football team right now. I was like, I really wish that we had that, but good thing for him, he's in a larger city, so I can find providers, but
Yeah.
so
Shoot, I wish they had this when I was in high school. I broke my femur in high school
yeah,
football. I wish they had that. It would
that's
have
what
healed much faster.
that's what that's why I tell people. I'm like and I think that's like too what separates it is just to be able to help these bone injuries like is just not there is no device out there that we have that can help that
Yeah.
can do that. So that definitely again that was very intriguing. It's just you're affecting people in a different way. So
It's always fun for me. Sometimes I get lucky enough to go to the group trainings, which I definitely want to touch
oh
on
yeah.
in a second. And then here's some providers that are very early on in their shockwave knowledge, and they will say
Mhm.
like, okay, so this helps with like joints and ligaments, but does it do anything for muscle? Does it do anything for bone?
Yeah.
And, like, yeah, it does all of that, and nerves, and regenerates blood vessels. I mean,
Yeah.
the list goes on. So. What was your group training experience like? And just for people that don't know, we have these group trainings. They're all over the country now. We have 5 locations, so it's pretty easy for anybody who's interested in getting trained on StemWave. And it's in a group setting. We have our clinical advisors that run these things, and you have medical professionals and all different types. There's MDs, there's PTs, there's chiropractors, there's all different types of people that are interested in shockwave getting trained at the same time. What was your group training like?
So ours was a little different because Dr. Jen Miller came to our
Oh,
facility.
very
Um,
cool.
so because we have so many therapists. Now, unfortunately, a hurricane like like thwarted that a couple times. So I think in the beginning we would have had a lot more. I mean, we ended up having about 7 to 8 ish, because we wanted as many of us trained, because I knew I can't just do this by myself. And so that, so she really tailored it to our, kind of our facility. And it was great having, and it's been great having her and just, her knowledge, to be able to, learn from, and then even ask questions. I mean, that's the other thing. I think that, just to be able to have a clinician, and then she even hooked me up with like another PT, so I could even like just ask questions about that too, just of how they integrated it. Um, so yeah, I mean, it was very much tailored towards us. And then I've since gone on a lot of, Dr. Manison's live calls, because, I do like his teaching style as well. So I would actually not mind going to one of his to hear like just, a different perspective too. So
Yeah, I've never met anybody who was able to retain information like Dr. Manison. I mean, he has almost memorized the thousands of studies done on shockwave therapy. It's pretty wild.
yes, definitely recalls lots of things. So
But that's so great. You got Dr. Miller that come out and
mhm.
train you guys. I mean, our whole clinical advisory team is fantastic. These guys are so good with training people on the device. Um, when you had your team there, like, was there any aha moments for your team? I mean, especially with like a new device like that, you get to try it out on yourselves and each other. Were there any members of your staff that when they felt it, they were like, "Oh, this is different."
Yeah, because I'd had some people had, because we'd brought in the laser to try, a couple years ago or so. So, um, definitely like, oh wow, yes, like this. In fact, like one of like our knees for sure. Like that, I had somebody that had an arthritic knee, and yeah, she's like, this is just different. Um, and at first, like it was just like trying to kind of get that, like, okay, how high do you go or not? And, just to actually, we're just kind of surprised by, I can feel that, like, because that's where it's different. Like ultrasound laser, you can't really feel it. Like you kind of just have to trust. And I will say that also, I think helps, is just that people can feel like, okay, something is happening to me, whether that is scientific or not. That plays a big part of people, you know, feeling like something's being done. So I think that was a big thing, is just like, oh, wow, like you can feel this. So,
Yeah, and it's a feeling you
mhm.
cannot get with anything else. Like the closest thing would be if somebody like cut you open and stuck their finger like as
Yeah.
far into a joint or something. I mean, it is in there.
Yeah, yes. And it's hard to describe. And even when I try to describe it to people now to like kind of prep them, it's just hard to, I just say it's not supposed to be super painful, but like, I'm there.
Yeah.
So I don't know. I don't know how, like, you know, to
Yeah.
describe it even. So
Yeah. You should feel something. It should not be like wincing, ow, 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 but you should be like, oh yeah, nope, that there's inflammation there for sure.
yeah, right. But that they can feel that you're actually there feeling that. But then you can go off the tissue and they don't feel it. So they know that there's a difference in like what a healthy tissue feels like versus what an inflamed tissue feels like.
Yeah, I personally think that's one of the coolest things about shockwave
Mhm.
is it is diagnostic. I mean, you literally can put it on a non-injured part and it just makes a sound. You don't feel anything, and then you get close to anything that's damaged or inflamed, you're like, oh yeah, that's
Yeah.
something.
Yeah. And again, that just validifies for him too. Like, okay,
Yeah.
yeah, I'm not crazy. This like this is hurt. So,
All right. So then like what everybody always wants to know
okay.
is you bring it in, you start using it on patients.
Mhm.
What were those things that were not treatable before that all of a sudden were you were able to hit?
Um, I'll probably the biggest one is the stenosis, which is that
Mm.
still wouldn't be what I would say to go out and treat right now, but it would be because those would have been the people that I can tell you I'd put through everything else. And so to be able to get to their nerve roots and make and again, usually they're like nothing's working, so they're willing to try. So that probably played a little bit into it, but that surprised me, like, for sure, because that I know those I was not getting anywhere with. And then the other one is the rotator cuffs. I mean, just being able to, like, they have partial tears, or even even they don't want surgery, or they may not, they can be on the fence with surgery. And to be able to change that tissue, um, was like incredible. So,
That's got to feel so
yeah.
good. I mean,
Mhm.
especially like the way that you described, how you got started when we first started talking about like you want to be able to offer solutions to your patients no matter what it is. To be able to tackle these things that traditionally you're not able to, like, that's got to be such a great feeling. See the look on your patient's face.
Yes, yes. And like I said, that's where it's like you hate to say, "Oh, there's nothing else I can do for you." Like that's terrible. I hate that. I mean, I'll be honest, if there isn't, but it was like to be able to give a solution that helps is yeah, definitely rewarding.
Can you recall any cases where you used it on somebody that, I don't know, maybe it was like a chronic thing that you can see it in their eyes, like they finally saw a glimmer of hope for like their life moving forward?
That the stenosis patient I was talking about, that was definitely one of them. Yeah, because it's like he was, pretty much. I mean, he just like as far as even he lived off like his pain medicine. Again, I didn't fix his stenosis. I don't want people to take that the wrong way, but it's just like he tells me now this is managed. Like I can deal with this.
Yeah.
And he can do his, day-to-day tasks that he wants to be able to do. And yeah, I mean, he's just like, yeah, this is like, I don't have to be in such despair. So,
Yeah, and then we do talk about this a lot, especially in these live Q&As, where we've started now just to really describe like being a StemWave provider as somebody that can give people their lives back. Like
mhm.
it's more than just treating injuries, it's more than treating pain. Like it's hard for people who have never been in chronic pain to understand, but for these patients that are in chronic pain to get some relief, like you're saying, like you didn't cure the stenosis, but you
Yeah,
gave him enough relief that he can do things in his day without feeling like he's hindered and not think twice about it. And he probably feels more like a human being again. And that's the quality of life that I think is such a huge aspect of what StemWave can do for people.
yes, yes, very much so. I mean, and I will say, and there also too, just in the athletic population, I will say like that initially, like I said, my kids are playing sports, so it's easy. I mean, I have access to a lot of athletes, so again, just to see like how quickly they healed and
Mm.
how it sped that up, and they didn't have to miss, like for them to not have to miss games, like that was huge. So
Yeah, I mean that's everything for a
yeah,
competitive athlete is like they
right,
don't want to be out, but at the
right,
same time you don't want to ruin their future by playing injured. So
yes, correct, yeah. So
yeah, we've had some pretty cool interviews with patients from other providers that were collegiate athletes or semi-pro or high school athletes that were being groomed for professional careers. And yeah, that's the main thing they say is, yeah, I'm not worried about missing time now. Like I know that if yeah, of course you're going to get injured, you're an athlete, it's part of it, but there's something out there that can get you back pretty fast. And honestly, some of the results that we've seen, I mean, Dr. Madison famously talks about like one pitcher that tore his ACL in like the beginning of the season and he got surgery and then used StemWave in conjunction with his rehab and was back on the mound for the playoffs. Like
yeah,
that's
yeah.
unheard of. An ACL tear? That's crazy.
Right. I mean, because that's the big thing with, ACL tears too, is just that you got to give it that time for like a lot of times the player themselves could be ready, but it's just like that graft isn't ready. So the
Yeah.
fact that you have something that's helping, facilitate that is awesome.
So one of the other aspects I want to touch on,
Okay.
obviously, we just talked a lot about the therapeutic side of StemWave, how much it can help, how much it can help give people their lives back and make them feel, like a person again. But from being a practice owner yourself, business owner,
Hmm.
there's another side of being a StemWave provider, and that's, you know, how you're able to monetize it, how you're able to, use marketing and all that kind of stuff, because we
Hmm.
do offer that as a different side of the company. We do have a lot of programs to provide you with marketing materials and support. Can you talk a little bit about your experience working with that side of the company?
Yeah, and in fact, again, because we were larger, we kind of have somebody that is in marketing, but again, it's been helpful just all the resources you guys have. And so to be able to utilize those and just even make our campaign like better. I mean, just even like the Facebook ads, Instagram ads, like all that type of thing. It just wasn't something we really thought about as much, and the direct like marketing, as far as like the text campaigns, email campaigns. So those were all things that we didn't necessarily have access to. So that was like very helpful. And that's what I feel like you got. It's like it wasn't like, okay, here's your device, go for it. Definitely, there's people there, and it's both from the educational side, from the marketing side, from the business side to help you like succeed at whatever your goals were. And that's where it was like too, like they kind of respected like where we're at. Like I said, I'm not an upstart. We mainly were we need to make this work. I mean, we need to make it cost effective, but I don't have to like this doesn't have to be my bread and butter. But I still need to make it profitable. So
Yeah.
they were very good at working with us in that realm.
Yeah, I think it's important for people to understand that, just like you said, there are a lot of devices out there that when you buy
Mm-hmm.
them, they just drop them off at your front door and then you never hear from that company again. And
Mm-hmm.
that cannot be further from how StemWave operates.
Yeah.
It really is a community. We have a ton of support. Also, when you become a StemWave provider, you get assigned your own personal client success manager,
Yes.
who onboards you. How has your experience been with yours?
Alicia's great. Very good. She's been very helpful, and very understanding, and again, working with it. That's been super helpful. And I again appreciate just and even too just getting you in the right direction or hooking you up with the right person to talk to. So yeah, again, I just don't feel like it's like I'm on my own. Try to make this work.
Yeah.
And all the, I mean, you probably get to hear too, but just like as far as the classroom, as far as like all the videos and then the access to, even if you can't get on a live coaching call, which usually I can't, but I can go back and listen to all those. And so you can really learn. Like I just don't feel, I feel like with all the protocols too, because it is, I mean, that's probably like, okay, yeah, I know this isn't that hard to operate, but as far as like there's a science and an art to it too. And so just to see the different, have the protocols that you can have for guidelines so you can have a little bit of a framework, and know that okay, this is consistently worked for several people. So, and just access to all the providers if you need to.
Yeah,
So,
the community aspect is huge. Um, just to let people know kind of a little bit more of what you're talking about. So we use this platform called School,
mhm.
and it's like a website where all of our providers are located centrally. There's message boards. All of the coaching calls that we do are posted there, so you can always refer back to videos. Like I said, we have the client success managers. We have a whole done with you program for helping with marketing, and everything is super accessible. Right there, like in School, all the videos, the protocol videos, like you mentioned. Um,
Mhm.
has there really been anything, the way that you were trained, all of the different things that are accessible to you that you feel like you've been kind of lost at, or has it all kind of filled in the gaps and been a pretty easy transition getting StemWave rolled into what you guys were already doing?
It's been, I mean, probably the hardest obstacle, and it's not you guys, it's like just with, like I said, just the way PT operates. I mean, it's a very much insurance based. So probably the hardest thing for us was just trying to separate, like if I'm seeing them as a current patient and then I want them to also be a STEM wave patient, I have to keep that account separate. And so but we figured that out. And that's where it's like just having like your guys's like data sheet, that made it easy. We can scan those into charts, and um, so we figured that piece of it out. I say that was probably what was the hardest to implement. But as far as what you guys provided to like do I mean, as far as what the training to actually get started was easy, super easy. So,
And you mentioned earlier that, when you guys got trained, it was like 7 or 8 of your staff members. I think it's important for
mhm.
people to know, if you are like a medical provider, you're a clinic owner, it doesn't all have to be on you. Like you can have
Yeah.
your staff trained. How has your staff responded to being able to use the STEM wave on patients?
Um, Fairly well. I mean, so I have my skeptics, but too. But as far as, um, they've been definitely helpful. And I have other therapists that are, willing to take patients, and we have physical therapist assistants that can help us even carry out some of the treatments. Um, and they see the changes as well. So it's like they and it's something different. So that's nice too. It's just like this is a different modality. It's a different thing that we're bringing in. And so they've they've all been willing and gone along with my idea and implemented it. So
I want to take a second, and
mhm.
for anybody that's watching that may have questions for Natalie or questions about the device, questions about StemWave in general, you can use the chat here in Zoom. You can just write your message in the chat, and we will get to it as we continue with our live Q&A. While we're waiting for anybody who may have questions, I'm curious, what is there anything that surprised you about StemWave?
um, that it helped or
Just
what
in general, like something that you weren't expecting, maybe like
oh.
either speed related, treatment related, results related, dealing with our team related. I'm just curious, like it's always good for us to understand what expectations were coming in and how they were met now that you're a provider.
Okay, I get so I kind of anticipate all the joints, so I could like I figured like the joints. Yeah, I get that. I see how that works. I think the thing that has surprised me is the change that you can make on a nerve. Like that is a bit, and I would say that it's taken me a little bit to be brave enough to like, okay, yes, that has happened, but to see that change or just how that nerve can respond to treatment is pretty amazing because again I have a little bit more of a neuro background, so I know that these things don't there's things that just don't always get better, and so to make a change on neural tissue is a big deal. Now again, I'm not saying that it's like this big miraculous thing, but to make some change, both either from a pain standpoint or I had a patient that with a graft, and so just to get that return coming back is pretty amazing.
Wow. Yeah. I mean, I've been surprised by the nerve stuff as well because you just think like, oh, nerves, it's like a whole nother level. But
Yeah,
we actually partnered with this clinic called Project Walk in Boston.
yeah.
They deal specifically with spinal cord injury patients.
Hmm.
They've been using StemWave for almost a year now. And look, I'm not going to tell you that they have quadriplegics getting out of their wheelchairs and
Right,
walking,
right. Yeah,
but
yeah.
they've been able to wean their patients off of pain medication.
Hmm.
And there's been some improvement in strength around injury sites and that kind of stuff. Patients that maybe were paraplegic that had trouble even just moving an arm from one side of the table can now lift a 10-pound weight from. And so what
Yeah,
does that mean? That means, like we said earlier, giving somebody their life back. They can brush their teeth, they can eat now, they can feed themselves. So yeah, the nerve thing is wild. And most people don't think
yeah.
that it can do anything for it.
And yeah, and that's I think the thing that because it does take longer. And so, to get people to, commit and buy in or like, yes, that's going to help. That was a little bit of a like push. I mean, both more so for me. I mean, I wanted to see it. And, that's why I had saw your Project Walk stuff. And so I was super interested in that. And so then to see that though play out in patients has been, yeah, I'm like, okay, no, this like we've been doing stuff for a long time and I haven't got this kind of change. So
Yeah, we have a lot of providers that are wondering like how do you pitch StemWave to patients that know nothing about shockwave that are like skeptical about a lot of like the new technologies. How do you speak to your patients about it to kind of get them on board?
so I tell them like I have, this modality that we've been trying out, and I explain it that, like, I basically say this can get to the cellular level. So the things that we've been working on that I can't potentially reach, I know this can get there. Um, and I'm pretty convincing when I say that. But it's just and usually when I kind of, and then also just explaining that just a 4 to 6 week, healing process happens. And so that you have to allow that time for that to change. And then most of them, that are, again, they don't want, one, either they're in enough pain that they want out of that, or two, it's just they don't want a surgery, or they don't, that's usually, honestly, most of the people, they don't want that rotator cuff surgery. They don't want a spinal surgery. And so they're trying to do something that's not invasive, to get better.
Have you seen a lot of patients that maybe were slated for surgery that were able to cancel?
Actually, yes, I wouldn't say a lot, but just because we
Or
haven't had it
any? I mean,
for a long time, but
one
yeah,
is fantastic. One's a
one
win.
in particular, like, she was
Yeah.
going to have a meniscus repair, and it's just like, but she's a young mom, really doesn't have time to go do it. And so to be able to, yes, we got her, out of pain, she's functioning, she's doing her, she can go back to doing her daily activities plus exercise. That's what she really wanted to be able to do. And so, yeah, she's pushed it off. The one, I would say, she ended up having surgery, but it was a great success because she wanted to go to, like, it was a friend's wedding or something. She wanted to be able to dance at it. Well, 3 months before, you can't have any steroid anyway. And so she was hobbling around. So, like, I could bring her on right now and she would sell it for you because she was so elated that, like, StemWave basically bridged that gap from that, time when she, yeah, she needed to have surgery. But then I can tell you, following her surgery, she recovered fantastic. So just getting rid of that inflammation prior to, and it helped her pain, which is what she was ecstatic about. But then her recovery was a breeze.
Yeah, I
So
think.
she'll tell you. I mean, that's what she always says. If you need me to tell anybody, I'll tell people.
Hey,
So
well, yeah, we're just get her to do a testimonial. I mean,
yeah.
things are so powerful.
Mhm.
We do have a question from
Okay.
somebody watching. Thanks for your information. I'm a clinic owner for 40 years in Milwaukee, getting ready to do a trial in early September. That's very exciting.
Yeah.
Have a staff that's skeptical, and hearing your journey
Yeah.
helps. Fantastic. Are you benefiting financially as well?
Yeah, I mean, for sure. Like I said, I had to I mean, for me to get my business partners to agree to it, I had to make sure that this was going to help us financially too. So, like I said, it's not our sole income, but we've easily paid off the device. And like under, I think he told me 9, 10 months. And so that's, and we're not, again, I've priced it kind of, we're Midwest. So, some people I price it just, cheaper, but, even for what we kind of set it up for, I think one of the clinical advisors said, like, know your area, know like how much it costs, basically, and know what you need as your profit. And, so I feel like what we set has definitely been, people aren't going, oh my, that's super expensive. So
Yeah, I think it's a great point to make too. Look, we've got almost 800 providers in the country right now,
yeah.
all different markets.
Hmm.
And like you said, you got to be smart about like what your market can afford. But we hear, just to also tag on to this question, we hear some really incredible success stories about providers able to do six figures in the first 90 days, like that kind of stuff. And it really depends on, number one, like Natalie's saying, like the market. Number two, how proactive you're going to be with your marketing, how on top of it are you going to be successful in that sense. And like I said, we definitely have a lot of support for that kind of thing, but we do have a 98% success rate for a reason. And that's not just with how successful it is on patients, it's also with how successful it is financially for businesses. So I think, if you look at all of our providers, you're going to see success across the board from the financial side. Another question, would you say StemWave can aid in a recovery process post-surgery? This is actually similar to what we were just talking about.
Yeah, actually 100%. It's just more that you can get, I mean, that sometimes takes convincing people, to do that. But again, that kind of I mean, Dr. Manison speaks to that more so, for sure. But if you just understand the science of what StemWave is doing and you implement that StemWave, post, a couple weeks or so, or whenever that the surgeon is allowing us to integrate the modality, it obviously you just keep facilitating that mesenchymal stem cell. And so, recruitment. And so, yes, you're going to aid in how that tissue is repairing.
Yeah, I think yeah, if you can go on our YouTube and we have a lot of great videos with Dr. Madison talking about all the different uses of stem wave to prevent surgery, but if it's necessary to use it in conjunction with surgery,
Mm-hmm.
all the different protocols and that kind of stuff. But we have seen great results with patients both not needing surgery and surgery was a must, if it's like a full tear of something, obviously.
Yes, yes.
And then stem wave has been fantastic pre and post surgery for getting ready for surgery and then coming out of it and recovering. Um, where is your practice, Natalie? I missed the introduction.
So we're in Quincy. So our main office is in Quincy, Illinois, which is not Chicago, but central kind of Illinois, if that helps. I'm probably 6 hours from, she said Milwaukee, right? I'm 6 hours from Milwaukee.
Yeah. We have a question from Matt. So Matt's onboarded but doesn't have a machine yet, so he's not familiar with running it at this point. Could you talk a little bit about what it's like actually doing a treatment with the stem wave?
As far as what it sounds like or
Well,
what?
just like, how long it takes, kind of like
Oh,
what it's like. Like you move it around a lot, you use gel, like just so he knows.
so yeah, so you use ultrasound gel to put on the area. So in that way, it's similar to ultrasound, but you don't use it like an ultrasound. So is it okay if I pull the?
Yeah, let's use props. We're going props, people.
All right. Okay, good.
Oh, look, she's got a handy. That's great.
Okay, so you don't want to be like moving it around like an ultrasound. And Dr. Miller talked about that too. But you do stay on an area so that you're targeting. So I almost use it like I'm saying a laser beam of where, and that's where I use my anatomy and I kind of go through it. I mean, it's just like you're just kind of, peeling those layers, in your mind, and you're targeting each of the tissues that you're wanting to get at. And then that's what I said. They have certain protocols of like how many now the intensity you're gonna, as far as on the machine, you're gonna adjust based on some of the biofeedback from the patient. But again, there's nice protocols for that, so you at least kind of know where to start. I will say something we did in the beginning that we definitely changed is everybody thinks they need to turn it up so you really feel it. But that is not the case. You need to get a little bit of feedback, but we don't want to create cell damage. So you're wanting that compression of the cell, but you don't want to be like they're pulling away or I'm going to be stereotypical here, but men tend to be like, yeah, crank that up. The more, the better.
No pain, no gain,
Yeah.
right? Yeah.
And that is not the case. And so I really I need enough intensity that I'm getting to the tissue, but I don't need it to be too high. So anyway, that's how, and it looks, I handle it just like so, and then I'll treat whatever area that I'm on, usually trying to so if it's a shoulder, like up in here, like I'm going to get the bicep tendon, I'm going to get up on the supra, spinatus, and then on that back part of the rotator cuff over into the attachment site. We'll do some of the joint capsule as well. Once you kind of get an idea of where their most inflamed area is, then you can focus more of your waves in that area.
That
So,
was fantastic. I think it was the first time on a live Q&A we actually got a demo with
okay.
the device. It's fantastic. It's also, I think, important to know that our shock waves are focus shock waves.
Yes.
So, like I'm going to use a prop too. Here's our little
Yeah.
applicator head. You can change the angle
Yeah.
while you're treating and hit a different part. And you don't
Yeah.
have to do a lot of movement like you were saying. You can just kind of rotate your wrist a little bit to hit a different part. I think that's one of the cooler things about our device compared to some of the other devices that are a little bit more wide. Um, Hendrickson is a PT as well, and he's asking, so you have used StemWave post TKA, THA, and TSA?
Um, yeah. So Post-surgical, yes, you can. Yes, if that's what he's asking.
And also, you've seen benefit with ACL reconstruction.
Um, yes, I'm a little bit so I have one right now. I take Dr. Manison's word for that one though. I would say he has probably the most experience with that. So,
Yeah, and Dr. Menison does a lot with youth sports as well. And so he's seen like the high school kids with the torn ACLs and that kind of
mhm.
stuff. And he has some unbelievable stories of recovery with StemWave and ACL reconstruction. But I'm not a medical professional at all. So
Yeah,
I'll
okay.
just say like
Thank you.
listen to him. He's the
Yeah,
specialist.
no, I mean, and he's like I said, that's where again back to the coaching got like you have access to all of that. So you can listen to, his in particular, especially if you like that's the type of patient that you have, and then he always brings in a study and puts that alongside it too. So
Yeah,
uh,
you can also
that's
email him at drmanison@stemwave.com, like Dr. Manison, Manison. He loves hearing from people. He
okay.
will
All
love
right.
to answer anybody's question who has any questions about StemWave. Cool. Awesome. So that kind of wraps up the Q&A part as far as taking questions from everybody watching. I appreciate everybody throwing questions in there. I do have one kind of last question before we wrap this up, Natalie. If you were going to recommend StemWave to another provider, another colleague, what would you say about it?
I would say it's the best non-invasive device out there. That especially for PTs that and chiros. I mean, any non-surgical person that we can do to change the tissue. And again, after practicing for 25 years, I just haven't come across any modality that does that.
Beautifully said. Couldn't have said it better myself. All right, so what I'm gonna do right now, I
Okay.
just in the chat, I just put up our website, stemwave.com. For everybody that's been watching and listening, if you have resonated with what Natalie's story, her journey with StemWave, if you want to get the same type of non-invasive, life-changing results that she's seen with her patients, just go to stemwave.com. We've got a bunch of places where you can click to get on a call with our team. It's going to be kind of like this. Our sales team is going to get on a call with you. I'm sure you can attest to this. It's a pretty
Yes.
easy conversation,
Yeah.
right?
Yeah. And they want you to be successful. Like that's where I actually kind of appreciated that too. It's just like not everybody that calls up and says, oh yeah, this is, yes, do this. I really do think they ask you the right questions and get you thinking about the things. So you're not making like some grave mistake or something. So
Yeah. Well, we don't say yes to everybody.
mhm.
We that's why we want to have the conversation with that first call to make sure it's right for your clinic. And I think that's a big reason of why we have such a high success rate. Because number one, the device works, it's awesome. But number two, like we make sure that it's something that's going to work for your practice, work for your patients, work for what you've already built, and not only offer you help with getting those types of issues that you couldn't before, but on the financial side, benefiting you as well. So yeah, you can definitely book a call with our team. Like we mentioned before, you can try it out for 60 days. If you don't like it for whatever reason, you could send it back. You don't have to pay for it, but chances are you're going to love it. If
Yep.
you've heard anything about what Natalie's been saying, you're going to see some life-changing effects to your clinic, to your patients. So with that, I will say, Natalie, it was an absolute pleasure talking to you. I'm so impressed by your success with what you're doing outside of just being a StemWave provider, but really happy that you are a StemWave provider and that you're able to offer the types of treatments that we know are possible with StemWave, and you're really changing lives with your patients. So appreciate you and thank you so much.
All right. Thank you for having me.
For sure. All right. Well, hopefully, next time we talk, you're going to have even more stories and even more clinics open. You'll be taking over the world with your clinics, and StemWave will be in each one of them. So,
All right. Thank you.
all right. Take care.
Yeah.
Thanks, everyone.
Bye.